and we welcome all that. And please feel free to raise questions, and our panelists will respond to them. Thank you very much. Yeah, to Dr. Shekhar Kuriakose.
Thank you. Good morning, fellow panelists. I am to do the role that was originally scheduled to Dr. Sharda Muralidharan, which I think is a demanding and tall order requirement. And I hope I'll do justice to what I'm asked to do. It is, and I do see Honorable Minister for Finance. Thank you, sir. Thank you for this opportunity, and also thank you for being there to attend this session. Um well, what we have learned over the last 2 to 3 years of various um, disasters that Kerala faced is the fact that Kerala's response, Kerala's mitigatory plans, Kerala's rebuilding plans have all been effective only because of the fact that we have a great lot of legacy in three different fields. And this we presented in the World Reconstruction Conference as well, when Honorable Chief Minister himself was making the presentation inaugurating the World Reconstruction Conference in 2019. What we have to realize is that these three pillars on which Kerala society probably is India's most resilient are one is our great advancements in terms of education, and that is public and free education. Second is our great advancements in terms of universal healthcare, which is again a fact that we all know. I just want to reiterate that it's again universal, public, and free by and large, even now. And the third aspect of it is all this kind of converted into the most localized form of governance, wherein the local self governments come in place, and that they kind of ensure that these facilities are kept abreast and that these facilities are publicly accessible, universal, and more or less free. So these are the three pillars on which that our society could be rated as the most resilient in the world. By far, you have seen how it is happening now. Even in the US, yesterday my professor from the US was telling that he got a check of $2,400 from the US government, wherein he and his wife both are already pensioners, have had good earnings. So he was basically asking, why are you giving us $2,400 for which my children would have to pay for? Uh, so, so instead of that, what is the approach that we took in Kerala? We looked at who really needs it, and we catered to the needy right from the beginning. So all this is possible by and large because that we, one, is fairly well educated. Two, our health systems and our own general health is pretty good. And third, we have our local leaders, our local administrators, who are people from amongst us who are able to basically take the whole process forward. Now, we realized, and of course, this learning is something that came the hard way. We realized that in the front of disaster management, there is a lot that the local self-governments have to say. This is slightly in deviation to what the national systems think about and how the national systems look at disaster management. Uh, if you look at what comparable things are there, if you look at the US, about 93% of the local self-governments in the US have their disaster management plans ready. And if you look at Japan, all the prefects, they now have their disaster management plans ready. And these are things that have been achieved in the last 3 to 5 years time period. So it's not that they all had this for legacy time. And now, if you look at India, Kerala is the state which has local self-government disaster management plans, at least as on date in 648 local self-governments. So, what is the value addition? And I'm basically trying to cut short this to be trim and clean. I can go on and on about what we saw in the plans. But if you look at what is the value addition in the disaster management plans, and what is different from 2018 and 2019, and how we position these plans, and what are these plans, what are the value of these plans. If you look at 2018 and 19, we fairly had sufficient time and peaceful time to prepare to do cleaning at local self-government levels. We were able to achieve a lot of routines in the routine time periods in 18 and 19 prior to the monsoon. But you look at 2020, 2020, right from January, we at the disaster management side and the health department side were all engaged in the processes of COVID. It was as early as in January 19th that the State Disaster Management Authority gave out the first alert about COVID, and this was even before the Government of India thought about it. It was in February 2nd that the State Executive Committee decided that COVID is a state-specific disaster at least, and that we have to tap funds from the Disaster Response Fund to tackle what is ensuing. This was all done based on an informed modeling exercise that was conducted by a team of epidemiologists at Disaster Management Authority. And we came out with these requirements, placed it before the State Executive Committee, placed it before Honorable Chief Minister, and said that we need to take on these measures. Now, right from the beginning, we were very clear that if any interventions have to really and effectively happen, it has to happen at the local level. And we also pushed, when we declared it as a state-specific calamity in February, there was a huge lot of criticism from various walks in Government of India saying that how can you do that? How do you take on a pandemic, an epidemic as a disaster? And we were very clear in our conscience. We said, no, well, we didn't invent COVID. It is not human made. Two, if snake bite can be a disaster, this can as well be a disaster. So we placed our arguments in return. Eventually, late in March, after 23rd, when the lockdown was declared, they also decided that what Kerala took 1 month back as a path forward is exactly the path forward in the nation. So they also notified nationally COVID as a notified disaster. So how did that? And when we were working starting from that period onwards towards tackling this great pandemic, a lot of routines broke down. A lot of routines didn't work. A lot of routines like cleaning of silt removal, cleaning, everything got stuck because we had to follow physical distancing. We had to do we had to do a lot of different activities which were not in the routine. This was only possible, and because I see the larger picture of what is happening in the state every day with reports coming from various districts, we see the effective interventions of local self-government in the whole process. But further down, when we realized that migrant laborers, their welfare would become an issue and that we have to tackle it, we took it up with Government of India saying that, see, there is an issue like this and we would like to really support them. What came after that was, well, you could also cater to the food and other requirements of the migrant laborers using SDR. Now, how do you effectively implement it? So we again thought about how to get going in it, and the local self-governments came in place. We approved and ensured that the collectors have a way of working with the local self-governments to take care of the migrants. Now, where does the plan fit in? The plan fits in primarily and to our advantage, the fact that all the local self-governments in Kerala became self-aware of what they are to face as disasters. This is the advantage and the edge that we might have to tackle 2020 monsoon as well. When they are aware, what we did to make them aware, one, we provided them with all the geospatial information that was lying at different silos for a long time. The last time that I saw such a large initiative of planning exercise using geospatial exercise was during our PRM times when I was still a kid and maybe a toddler in the whole game. And from that time, to now the maps were lying in oblivions. The maps, the use of geospatial information in planning was in oblivions, and we were able to bring it to the forefront and provide 33 different data sets to all local stakeholders. Kila pitched in, worked with us extensively to redraft the national procedures for village level disaster management plans to fit to the local requirements of the state and create local self-government DM plan guidelines. This was also formally approved and issued. Extensive training was conducted by Kila for the local self-government resource persons, and with their help, now we have 648 done, and I am sure that all the other local self-government would have also done. So this self-awareness of what they have to prepare for is great. It came in handy during this COVID also. The local self-government, we already had a repository of different institutions wherein we could use. I'm giving an example of what came out of that plan. We had a repository of institutions that we routinely use as scams in the state. Now, COVID presented a different scenario altogether. COVID demanded that our resources are stretched to the edges in terms of infrastructure as well. So when we had to start thinking about quarantine centers, when we had to think about the contingency plan of COVID frontline treatment centers, it became so necessary that we have to inventorize every possible infrastructure in the state. So SDMA gathered all that from different sources, and Kila and local self-government put in a team to examine all these DM plans and come out with the list of infrastructure available in various LSGs based on the plans. You would not believe there were about 30,000 inventories of buildings and structures that could be used as different camps, different kinds of camps. And these things would not usually fall in the radar of a state or a district. It included houses, it included local training centers. So that massive inventory came forth, and we now basically collated it with the state inventory and updated our own inventory with that. So we can see that local self-governments are so much self-aware by doing this one single exercise. The moment you asked, they gave the plans, and from the plans, a gold mine is unraveled. They have also created a number of rapid response teams or emergency response teams, as we call. These are large set of volunteers which would also cater to, they are presently catering to COVID response. They would also be kind of leveled upon for the 2020 monsoon season. So this initiative is something that we took notice of. We have complete ownership of it, and we own it up. And as a change again, ultimately everything boils down to devolution of funds, and that is something that we have to realize, that any commitment to a particular cause is finally well explained when there is a government stake in it in terms of currency. Now, for that, what we have presented, and Honorable Minister was also there when we presented this before Honorable Chief Minister to seek his approval. We are for the first time thinking of providing certain allocations from the State Disaster Response Fund for needy local self-governments to tackle coastal erosion and also certain issues related to the erosion situation happening along rivulets. So this, and Kuttanad particularly, Kuttanad and coal lands in Trichy. So this is actually a new experiment. We are putting in certain regulations and checks on how to do this, but then this is something that we are attempting for the first time. So there, based on the confidence that we got from seeing the plans that the local self-governments have made, the State Disaster Management Authority is also slowly realigning the way that funds are devoluted for response. Please remember that I'm talking about response funds. Mitigation funds, we were already, as much as we had, we were providing mitigation funds until now was only state government contribution. So there is actually a paradigm shift that is slowly trickling in. Of course, we learned the lesson, and based on the lessons, we are realigning. And local self-governments, as I explained, comes in the forefront. This is slightly different from the national scenario where it's a top to bottom approach in disaster management. Given the strength of Kerala, the three pillars that we stand on as a society, we are hoping that we will have to invert the pyramid and take the ownership to the last mile. Every individual has ownership, every community has ownership, and eventually the state will give an umbrella ownership. So that is what we hope in the few years to come to have from the disaster management scenario. I stop with this. I'm willing to answer questions, but in the meantime, I would request the moderator to demand the panelists for their interventions in this topic. Thank you.
Yeah, hello. I think Dr. Kyriakos, thank you very much. We will be moving to Nirmala, but I also, for the benefit of those who have joined only today, I forgot to mention that yesterday we have been dealing with the state level experiences other than Kerala. Today we are going to focus on the specific experience of Kerala, wherein the opening session is setting the broad background in terms of how Kerala has been equipped to address the pandemic in general. And this session is very important for the whole day's discussion. So we had the opening remarks by Dr. Shekhar Kyriakos. Now I request Nirmala Sanu George, please.
Thank you, Dr. Joseph, and good morning, everyone. Am I audible? Hello?
Audible.
Yeah. Thank you, Dr. Shekhar, Isaac Sir, Gift, and Kila. I'm honored to be part of this webinar. I'm also thankful to COVID-19. I think the invisible transformer, without which the third tier of governance could not have got this level of prominence now. And I think it is transforming us in many ways. It is also brings new challenges to the skills and capacities of the government and society as well. And if you look the last 2 decades, we find that the international organizations have been focusing on sustainability and risk reduction. The UN General Secretary had positioned 2020 as a super year for action on sustainability. If you look at the SDG goals, SDG 3 is devoted to good health and well-being, with an emphasis on early warning, risk reduction, and management of national and global health risks. I think none of us took note of this until the entry of COVID-19. The Sendai framework for disaster risk reduction emphasizes a comprehensive approach to address multiple hazards that impact at different scales, frequency, and intensity. Again, in 2019, WHO has come out with a health emergency disaster risk management framework. But often we forget to tackle the key driver of the disasters, the climate change. The 2018 IPCC assessment report also highlighted that climate change intensifies health risks, including pandemics. We didn't notice this too. Our country now is handling the first pan-biological disaster, which is the 7th biological disaster notified by the India government in the last 4 decades. Now, if you look at the history, we understand the modern methods of crisis management started in India with the first famine commission in 1878. But the Constitution of India was so silent on disaster. However, in 2005, the legal basis was laid with the DM Act. The Act came under 2 entries, entry 23 and 29 of the concurrent list of the Constitution. Entry 23 states social security, social insurance, and entry 29 states prevention of the extension from one state to another of infectious disease or pest affecting men, animals, or plants. But yeah, I just wanted to raise that somehow women is left out. It's a fact that women bear an additional stress in disaster situations. That they bear a disproportionate burden of the additional domestic and income generating work necessary for survival, which we all know. And I also congratulate Killa for coming up a rapid study on the reported domestic violence during the first phase of 1 month of lockdown in Kerala, which is available in their website for those who are interested to have a look at it. Now, so far, the National Disaster Management has issued 30 guidelines on various disasters to be managed by the different ministries, central and state, districts, and other stakeholders. And 12 years back, 2018, the guidelines for management of biological disasters was also issued. And last year, in 2019, the National Disaster Management Plan was issued, which also deals extensively on biological disaster and health emergency. And if you look at the DM Act, it also states that the supervision of the district authority, every office of the central and state government has to prepare a disaster management plan after consultations with the local authorities. I have some questions. Maybe Dr. Shekhar can give a more insight into it. Are the plans being prepared like that? Is the plan revised annually? Is there a budget for these departments or district levels to have regular interventions? I don't think we have considered or integrated any of these guidelines in the state planning process in the country as well. And how can SDMA help in this whole overall planning process hereafter? And today, Meenakshi sir raised a question on the definition of local authority as defined in the Act. I too feel it lacks a lot of clarity because it says it includes Panchayat Raj institutions, municipalities, town planning authority or Shila Parishad, and the different boards like the district, cantonment, or any other body by whatever name it's called. It's defined as for the time being invested by law for rendering essential services or with the control and management of civic services within a specified local area. Is it in time to redefine local authorities as raised by Meenakshi study? And also the ex officio co-chairperson of the DDMA is the elected representative of the area. What role do they have? Do they have an equal role in the decision making? Shouldn't the powers and functions of DDMA be extended to the local governments based on the principle of subsidiarity? Yesterday, it was really exciting to hear about the decisions taken by the Odisha government in this respect as well. Now, anyway, COVID-19 has set high expectations from the local governments to respond to social and economic needs urgently and humanly. The Panchayat Raj Act mandates the local governments to ensure social justice and local economic development. It means in any situation. It's not just the regular activities alone. So in 2018 or 2018, Kerala local governments spontaneously and efficiently responded to the flood rescue, relief and rehabilitation operations, but only a limited extent in the reconstruction or in the rebuild Kerala initiatives. Now, if I borrow a few words from Vijayanand sir, the series of disaster which we had one after the other has made Kerala local governments capable to respond in anticipation and responsibly do surveillance and monitoring in caring, welfare and distribution. The caring nature naturally comes in as 57% of the local governments in Kerala are headed by women. So to function effectively and efficiently, do the local governments in India have an efficient organizational setup? Do they have the capacity and resources? Do they have a specific disaster management plan? And is the community empowered to respond to a disaster? Now, in the last 30 years, there has been a fivefold increase in the number of climate-related natural disasters worldwide. Till 3-4 years back, we were not ready to accept that climate change is a key driver of natural disaster in Kerala. I'm speaking more on Kerala. Kerala was not concerned about the geophysical or the climatological or the meteorological changes which so far has affected the state. in the due course, people got adapted to the changes and were not sensitive to the meteorological hazards, I think because it affected only the coastal areas. In 2018, the hydrological disasters was required for the state and community to accept the fact that Kerala is the most vulnerable state towards climate change in India, probably. So we cannot ignore climate change while thinking of disaster management. That is what I wanted to stress again. As Dr. Shekhar explained in detail, the Kerala Grama Panchayats was in the process of preparing a community-based disaster management plan when the pandemic struck. And I congratulate Sharada Madam for being so determined that it should happen in 2 months' time. And I would say it was a timely decision because it started in the same time when the virus originated in Wuhan. I don't know how it became a coincidence, but the decision was to take, her decision was to take this massive exercise of training and forming ward level response teams and preparing the plans in 2 months, as explained detailed by Dr. Shekhar. Kila, with the technical support of STMA, was able to train around 2 lakh people by January 2020. I'm very sure this definitely helped the local governments in Kerala to act to the present pandemic. Coming to the climate part, we have a national and state action plan on climate change. Kerala has developed some initiatives and methodologies to address climate change by the local governments as well. For instance, the Meenagadi Grama Panchayat is known for its carbon neutral initiatives, which was under the leadership of Dr. Thomas Isaacson. And 2 years back, Kila had taken a number of other steps as well. Kila had trained the Grama Panchayats of the 4 hotspot districts to prepare a local action plan on climate change. Though there was an availability of local experts and micro-level information, Kila was able to pull in some experts from universities and others to support the panchayats, and a few panchayats were able to complete the task before the 2018 floods. Also, studies were done by other agencies on health vulnerability assessment, coastal vulnerability, impact of climate change on women and differently abled. A few methodologies were developed, like the Health Need Action Plan for the Health Department and a financing framework for the climate change based on Kerala finances. Now, we need to move ahead with these efforts while reworking on disaster management plans. Capacities have to be built, but not the conventional capacity building as Raghunathan sir mentioned yesterday. It has to be availability of the appropriate information and technical support at the right time. I here emphasize that we need to enhance the technical skills of the devolved functionaries to the local governments. Now, I conclude by reminding the participants of this forum that both COVID-19 and climate change has 2 similarities. Both are global. They do not respect any national boundaries, and both require joint efforts to find mitigation and adaptation solutions. Therefore, local governance is more important than ever before. So they have to come up with disaster management plans with local climate actions, which can be integrated with their regular development plans. Kerala can do it, and Kerala can help other local governments to do it. Thank you.
It was in fact a very useful intervention, adding on to and highlighting the relevance of local level initiatives towards addressing pandemic in general, and also the capability building, and your reference to climate action and the similarity between COVID and pandemic are well appreciated. Now, I would also like to inform you that in addition to the panelists noted here, we'll have Dr. Joy Lemon also will be making his intervention at the end, I suppose. Yeah. Okay, next, let me call upon Dr. Where is the program? Sunny? Professor Sunny George? Hello.
Sir, first we will play his video.
Dr. Sunny George. Yeah.
Respected ladies and gentlemen, local governments in Kerala have a very important role in managing disasters in the state. I am happy to discuss the role of local governments in disaster management within the general framework of capacity building and training of local. Kerala has highly empowered local governments in the sense that the constitutional mandate of planning for economic development and social justice is being carried out by all local governments. Apart from sharing the financial resources, the state has transferred all sectoral institutions like agriculture, animal husbandry, health, education, etc. to the local governments. As a result, the area of operation of local governments in Kerala encompasses all aspects of human life, including disaster management. It is interesting to raise a question. What makes Kerala different in disaster management? There are three fundamental aspects. Number one, the development of social infrastructure. Number two, the accumulation of social capital. And number three, the social intermediation in a self-disciplined planning system. All these aspects inbuilt in Kerala society become explicit and identifiable since the introduction of the very popular People's Plan campaign in 1996. The achievements in managing disasters like Oki, flood in August 2018, and the experience in controlling Corona demonstrate the strength of Malayalis, the people of Kerala, in disaster management. I confine my discussion to the capacity building of local governments for managing disasters. In order to understand the process of the capacity building in its full sense, I would like to familiarize you with the established conventional system of capacity building of local governments in Kerala. Kerala Institute of Local Administration, popularly known as KILA, is the nodal agency for the capacity building of local governments for both rural and urban in Kerala. KILA also shares the Kerala experience to other states and other countries for wider dissemination of democratic decentralization. The institute functions as an interface between the local governments and the state government. It may be noted that the people in Kerala are very familiar with the participatory planning process. For any new initiative by local bodies, KILA normally prepares a framework for that activity in the form of a draft policy document or a draft government order in consultation with the local governments. The state government makes necessary changes and issue formal government orders for its implementation. By this time, KILA makes all preparatory works for massive statewide training programs. In the training programs, apart from the content of the government orders, we discuss all aspects relating to its implementation. The feedback from such training programs are sources of information for further changes in the government directions. This iterative process of information flow from bottom to top and top to bottom ensures that the envisaged activities are implemented in a meaningful manner. This is, in fact, the real strength of local governments in Kerala in facing challenges. All these aspects become more clear when I explain the training for disaster management. Before describing the details of the capacity building activities for the preparation of the disaster management plan, I would like to bring to your notice about an important training program that was very closely related to and supportive to the disaster management. It was a state level initiative on sensitizing the local governments on the impact of climate change and the adaptation and mitigation opportunities before the local governments. The content of the training program includes understanding climate change, geographical and socio-economic aspects of Kerala, role of local governments in adaptation and mitigation of climate change, analysis of impacts of several areas like agriculture, animal husbandry, fisheries, coastal areas, forest, biodiversity, water resources, health, energy, traffic, waste management, tourism, and urbanization. This training program familiarized the impact of climate change and its implications for disasters. It helped realize local governments that Kerala is a disaster-prone area. Now we may look at the training on disaster management for the preparation of disaster management plan of local governments. The steering committee of the local body is responsible for the preparation of the disaster management plan. There is a special working group for this purpose. At the ward level, there are 20 local resource persons. These three categories of people are trained for the preparation of local government level disaster management plan. The master trainers for this training were developed at three levels: state, district, and local. At first level, we developed the master trainers at the state level. The participants include experts from State Disaster Management Authority, Planning Board, Department of Town and Country Planning, resource persons of KILA, etc. Duration of the training was 2 days. At the second level, we developed the district level master's trainers. The participants were experts from Biodiversity Board, experts suggested by the district panchayats, and other resource persons. Duration of the training was 2 days. At the third level, we developed the master trainers at the local body level. Participants of the master training at the local body level include experts from NGOs and community organizations. Duration of the training was 1 day. The content of the training include 8 sessions. 1. Campaign for disaster management. 2. Climate change, land use, disasters, and resilience approach. 3. Disaster management plan. 4. Familiarizing the maps relating to the disaster management. 5. Group works. 6. Preparation of disaster risk reduction plan. 7. Disaster management plan, annual plan, and activity calendar. And finally, 8. Questions and answers. Actual training was conducted in 5 phases. During the first phase, the training was on disaster management plan guideline for the steering committee and the disaster management working group of the local governments. In the second phase, the training on disaster management plan for the local resource groups were conducted. In the third phase, training provided to the other working group members. In the fourth phase, training given to the plan clerks, who are the critical official in handling the matters relating to the participatory planning process in local governments. In the fifth phase, training was given to the local resource persons at the ward level. In total, 1,77,521 persons were trained for disaster management in Kerala. Coming to the COVID-19 pandemic, the local governments are engaged in various activities because of a well-disciplined process of communication among the local bodies, state government, and other institutions, which I have explained in the outset. The biggest challenge is found to be the question of livelihood. In this regard, it may be noted that Kerala has a unique program called Ayangali Urban Employment Guarantee Scheme for providing employment to the unskilled laborers in urban areas in the pattern of MGNREGS. The local bodies are documenting their activities relating to the disaster management. More than 75 videos are shared in social media under the title Urumeyude Prathirodha Gatha. Many lectures and webinars are being conducted. These are our basis for further identification of activities and capacity building. In sum, we can say that these are the results of our accumulated social capital and social intermediation. Nobody is left out in the process. All are included, including animals, wildlife, and biodiversity. Hope that Kerala will overcome the challenges of COVID-19 and other disasters in future. Thank you.
Thank you, Dr. Sunny, for those very interesting remarks or discussion about the multidimensional perspective in which capacity building initiatives are being initiated in Kerala by keeping the local self-governments in mind. Okay, now may I request Dr. Joy Lemon.
Good morning. Actually, three panelists have already talked a lot about disaster management by local governments. So my task is a comparatively easier one, but still I would continue to talk about what they have left behind, and then I will continue to do that. See, when we consider all these things, what happens in the times of disaster? It's an emergency. As people always say, it's a war situation. Deal it like a war, and that requires coordinated efforts. And uniformed and non-uniformed forces have to come together in such a situation. Uniformed means you have the police, the military, and fire force, and all kinds of people, and then all other workers have to come together. And there should not be any confusion, no miscommunication. It has to be perfect. And the roles have to be clearly defined. The role clarity is an important constituent of this. And naturally, there has to be a single point of command and single line of communication. So basically, it is command and control. This is the conventional way of dealing with disaster. And our National Disaster Management Act is based on these kinds of principles and approaches which they have adopted. Yesterday, we had our discussions whether can we deal COVID or such disasters simply like a war. Are we actually in a war situation or something beyond that? And if you take a particular case of COVID itself or for any other matter, any other disaster, actually who can do this in each of our states in the local level? In disasters, who is the first respondent? Who knows the area? And finally, who understands the community? This is totally different from what we do in a war situation. Not totally, but there are different. This is actually different from what we do in a typical war situation. It is also a war, but not the real war which we are talking about or seeing in other ways. So who is the first respondent? Who knows the area? Who understands the community? And such questions, I leave it to you. But our system, we have it's all based on the National Disaster Management Act. Then there's a National Disaster Management Authority under the chairmanship of the Prime Minister. We have the State Disaster Management Authority. Chief Minister is the chairperson. And then we have the District Disaster Management Authority. Chairperson is the collector or district magistrate as it is. But then there is one more thing. An elected representative of the area is an ex officio co-chairperson of the District Disaster Management Authority, which we have ignored over time. I mean, for our case, for example, the District Panchayat President is the co-chairperson of the District Disaster Management Authority, which none of us have noticed. And yesterday also we discussed the same thing. So that is the system we have. And then there has to be the disaster management plans, national, state, and district. And there again, it's clearly written that the district plan shall be prepared by the district authority after consultation with the local authorities. Local authorities, you have to bear in mind. And then how you prepare again, in each of the clauses, there is a mention of the local authorities. Okay. And then every office of the Government of India and the state government at the district level and local authorities shall prepare a disaster management plan. See, at the district level as well as the local level, the local authorities have to prepare a disaster management plan, which again we have not done in that way, because one of the other things is also who is the local authority? Where is the local government which we are talking? And there again, Nirmala just concluded by or talked about the definition of local authority, which means clarity. But local authority includes Panchayat Raj institutions. which means there is no question. See, local authorities, the Panchayat Raj institutions, the municipalities have to prepare a disaster management plan. So we had the NDMA Act in 2005, and we have not actually bothered to venture into the local disaster management plan by a Panchayat Raj institution or the municipality, and Jilla Parishad and all others is mentioned. So that is where we come in, and that is how we have actually, in Kerala, we have tried to prepare a local level, community-based disaster management plans by the local governments. We started it exactly at the time when in China, the first case was reported. In Wuhan, the first case was reported, but we didn't know at that time we were into such a situation. We actually prepared it based on all these principles which I mentioned, and then we started preparing the local level disaster management plan by the local government. And what should be there in disaster management as part of it? It is based on some of the principles, like it is to prevent danger or threat of any disaster as planned, mitigation or reduction of risk of any disaster or its severity or its consequences, capacity building, preparedness to deal with any disaster, prompt response to any threatening disaster or disaster situation, assessing the severity or magnitude of the effects, evacuation, rescue and relief, rehabilitation and reconstruction. See, it covers everything for a disaster management plan. And Kerala actually, I would say, in 2018, when we had the floods and the landslides, the first thing which happened was, actually the announcement started coming in the midnight, and then the night itself, all our elected representatives, the officials ventured into informing people, evacuating, rescuing and all kinds of things. And they went back to their own houses only after the camps were closed, and then they found that their houses were in also danger. So that is the kind of commitment, involvement of the local governments during that time. But then I would also say, I mean, in a different way, that the next round of floods for them started after that. See, of course, it is about the flooding of grievances. Post-disaster, there would be a lot of grievances, and everything went towards the local governments, the elected representatives, the officers. Why? Because in Kerala, they have established themselves as real local governments, governments nearer to the people. If some of you might remember, when we started the People's Plan campaign, there was also this great question: are we actually moving towards decentralization in the way some people used to say about states moving out of the services and other things, and the state and the governments are actually moving out of the services and it is left to the people kind of thing. Then we put in a formula saying that, a concept saying that for ourselves, decentralization means strengthening local governments, means it is actually bringing governments closer to the people. And in 2018, we have the evidence to say that people, even though local governments were not mandated or formally mandated to consider all these grievances or about the disaster management, people flocked towards the local governments simply because they found that over the last 24 years, they found that these are the governments more closer to us. This is our government kind of thing. And so it happened. And in the meantime, I have to also say that after that, we have a working group in every local government. It is on environment, biodiversity, climate change, and disasters. See how each local government in Kerala has a working group for preparation of plans where environment, biodiversity, climate change, and disasters are considered. And Nirmala and Dr. Sunny George had already talked about what Kila did in these kind of things, especially the local action plan on climate change. Then some of the panchayats like Meenangadi are trying to do the carbon neutral panchayats addressing climate change. And also one needs to also understand this is related to disaster management again. It's about the biodiversity management committees. See, it's national, but in Kerala, every local government has a our Gram Panchayat has a biodiversity management committee and the biodiversity registers. And now Dr. Sunny also talked about how we did the trainings and all. I am not going into the trainings, but see how the disaster management by a local government looks like. Are the steps, for example. The steps, actually the DM plans, the disaster management plans are prepared under the leadership of the local government steering committees with the support of the working group, which I mentioned. But then disaster management is not another sector or another department. It is actually bringing together all. And so all other sectoral working groups also have to join in this venture. Then we also have the various community-based organizations like the Kudumbashree and all in place. So finally, what I wanted to say was that now the further steps actually is about incorporation of our disaster management plan into GPDP, the Gram Panchayat Development Plan. And then that integration of disaster management plan into GPDP is followed by the disaster management plan being sent to the district planning committee. This is how we have envisaged it. And the DPCs vet it, and then there will be a district level seminar, and then to the district disaster management authority, and that gets incorporated into the district disaster management plan. So it is based on the National Disaster Management Act, and where it also says that there is a requirement for local authorities to prepare the disaster management plan, and then it gets integrated into the district disaster management plan. Later it gets integrated into the state level disaster management plan, and it contains mitigation, preparedness, actions for mitigation, preparedness, rescue, relief and rehabilitation, responsibilities, projects to be included in the GPDP, suggestions to other tiers of local governments, departments, district administration, state government, and all others. So finally, what I wanted to say is that we have actually prepared a system, developed a system which looks into disaster at the local level by the local governments based on the National Disaster Management Act itself, but interpreting or understanding it in a very comprehensive way and considering the local. So this is how the local disaster management plan gets in, and this has to get integrated into the development plans or our annual plans of so-called Gram Panchayat development plan, so that all aspects are covered under a single entity. And this has become very useful, as Dr. Shekhar said, when this COVID-19 came in, we could use, many panchayats could use some of the activities taken up by the disaster management plan preparation, and it has become useful. Thank you.
Thank you, Dr. Joy. I think altogether it was basically reinforcing that Kerala has what is called a disaster management system, which is entrenched to the grassroots level of panchayat level. And at the panchayat level, they are not really passive instruments, rather active agents. And there's a system built in over time to capacitate through various initiatives and the institutional architecture that we have evolved over time. Okay, now Dr. Shekhar Kuriakose, I would like to inform you that we have a few questions. First of all, let me thank Usha Ravindran, Francis, Sri Kumar, Anjali, Carol, Anita, Shashidharan, Adiodi, and others who have joined us by way of providing comments and questions. Usha Ravindran would like to say that Kila can give clear-cut training for awareness of COVID to selected people. Yeah. Francis, but potential of geospatial technology should be fully understood and utilized. I think these are all well taken. Sri Kumar, an excellent initiative. It is very important that the local government has to be empowered much more in this scenario. Yeah. Yesterday, I remember our minister rightly summed up the whole discussion at the national level, saying that it's very good to see that things are changing, but he was saying that we need to travel a long distance. Similarly, here in Kerala also, Sri Kumar appreciates, but they have to be given some more freedom to take decisions at the critical stages. I think panelists would like to respond, I'm sure. Anjali would say that the government sector should have to be, they have to implement from the grassroots level, panchayats of Kerala, to ensure the plans along with Kila. I mean, essentially they are trying, I mean that Anjali would like to see that local self-governments are working much more closely with Kila. Carols, I want to know that in Kerala and in other states, whether the Gram Panchayats are doing capacity skill mapping of the return migrants. Yeah, very interesting question. And how Panchayats are planning to utilize these information. Of course, I know that they are going to come with ideas and objects. How are we going to take these ideas? Very interesting. Anita Kumari to Shekhar. Dr. Shekhar, LGS are finding, local self-governments are finding difficult to do its mandatory functions. Now, due to lack of agency function, and now due to the agency functions assigned by the government. Shortage of staff is a serious problem. In fact, I would like to add that our minister has been making a clarion call for many years to say that all the people should not be crowding in secretariat, rather you should go to local level. I think this is something which is reflective of that. Shashidharan Adiodi, what about present assessment of Panchayat Raj program in the state? I think this is not a complete question. Yeah.
I have a question to the panelists. I'm certain all of you must have read through a large number of local disaster management reports. How do you rate them? Definitely, we try to be incremental thing. No, this is not the final version. You will be adding on. But how do you assess these reports in relation to the guidelines that were given? That's number one. And perhaps Nirmala can definitely respond. How do you compare them with the development reports of 1996? So I would like your opinion regarding an assessment of the reports that have been already prepared by the local governments.
I would like to say that there are more questions and comments from Shraddha Jain, Thomas Tunguri, there are others. Shraddha would like to know, perhaps after the role of the local self-governments ahead of the pandemic. I mean, Shraddha, please wait. Let us cross the bridge. After that, we'll think about it. Shraddha would like to know what are they going to do after. I mean, Shraddha is from CDS. I know. Okay, over to Dr. Shekhar and everyone. Take 1 minute each because minister is waiting to address the Shailaja teacher is waiting. So we have to be brief and conclude soon.
Sir, your question regarding how do we rate the plans that are prepared. In a scale of 10, I'm a very conservative man in awarding marks, and that I'm notorious for. So if you put it in a scale of 10, I would rate it at 6 overall. And if it is to be examining each one of them, there are some which I would definitely give a rating of 9, and some which I would not even think of reading. So yes, as you said, and as Disaster Management Authority always looks at disaster management plans as living documents. That's what we are taught, that these are documents which has to be evolving daily as situations emerge. So as a living document, overall, the 648 out of that, at least 30, 40 I've gone through, I would say that they could be easily rated at 6 to start with. And we can be very proud that we have done a commendable job. I was a little student when the whole 1997 activity was happening, and I used to look upon you and the elders there in from CES who were guiding us in doing it. And the 1997 plans were far more prudent and I would say organic in nature. So I still remind them. When we started this program itself, I requested Kila, Go Elements and team to dig out those snaps, because that still is a very good source to understand and lay a benchmark. So I stop there, sir. Thank you.
Teacher speaks. We'll continue the your response. Eh? She is already present. So, comrade, there have been a lot of demand, particularly after the Guardian article. Lots of people want to hear you. So thank you for coming as a such short notice. Thank you very much. Welcome to the webinar.
The previous remarks from you. Can you hear me?
Go ahead. We hear you. Yes, we hear you. We
Yes,
can hear
I
you.
didn't hear your previous remark. What is the?
Only saying that your fan club is expanding nationally.
Sir,
After
it
the
is not
Guardian
mine,
article.
sir. It is not mine. It is yours also. Yes. What is the? What am I to speak, sir, about Nipah? Sorry, about the corona containment or?
No, I mean, next session is going to be local governments and the health. And therefore, you can choose whatever you are comfortable. But anyway, you're tackling Corona itself, narrative itself will be an important contribution. Yeah.
Shall I speak now itself, sir?
Go ahead.
Okay, okay. Good morning to the dignitaries who are participating in this conference. And Kerala is trying hard to tackle the problem, the coronavirus COVID-19. It is not very easy, as you all know, but because of our decentralized planning and our stringent action and good leadership from the Chief Minister and also from our Finance Minister, we are now trying to contain this, not contain, but we are trying to flatten the curve of the coronavirus here. And we can say we have three phases of this attack of the contagious virus. And we are now in the third phase. The first phase, when some people from Wuhan returnees come here, at that time, the first coronavirus spread occurred here. But we planned earlier because of our pre-planning and very emergency preparedness. That helped us to prevent the spreading of the virus in Kerala. Because when we heard that some new kind of virus, new kind of SARS virus is spreading in Wuhan, China, we started our preparedness here. Because we were sure that someone will definitely return from Wuhan to Kerala because so many students are studying there in China, Wuhan, especially for medical field. And we started our preparedness here. We opened our control room and we insisted all of the 14 districts to start their control room also. And we started vigorous training. Everything we started earlier. As we expected, some people returned from Wuhan. It is on January 27th, but we started our planning and preparedness from January 2nd week itself. January 23rd, we have our rapid response team meeting, especially for this SARS coronavirus 2. And we opened our control room January 24th itself. After that, the WHO declared in March, I think WHO declared it as a pandemic. But we started earlier. And as we expected, some people returned January 27th to Kerala. And we screened all the people who came in that flight from Wuhan, from China. And we, from the airport itself, we screened them. And we got 3 symptomatic cases out of that. More than 72 people were there in that flight, and we got 3 out of them as symptomatic, and we sent them to the hospital isolation, and we took the throat swabs and sent to virology lab, and we sent all others to home quarantine. we prepared very good advisories and guidelines for them. From the airport itself, we gave them that advisory to the passengers, and you should be in their home in a separate room and don't touch others, like that. At the very same time, we prepared our protocols and also standard operating practices to tackle this virus attack. And that 3 persons who were shifted to the hospital become positive. But fortunately, they were under our control in the hospital, and from them, no other contact cases occurred. And that was the first phase, and we yield very good result out of that. We can contain the spreading of the virus in that case. Second phase again occurred after the discharge of these 3 students from the hospital. Between that 2 weeks, no new cases occurred, and we think that it is over, but we cannot think so. We find out that the coronavirus is spreading throughout the world. The virus flew to UK and USA and also to Italy, and again we are in a peril. We thought that definitely people will return back from Italy and USA and every part of the globe. Again, we continued our preparation and practices. Our vigilance we continued. We didn't withdraw our team from the airport. Our screening team stood there itself. Some people said that, why are you overacting? And it is over, but we didn't withdraw that team from airport. And later it showed that our system is right and our preparation is right thing. And after that, after 2 weeks of the discharge or recovery of these Wuhan people, some people came back from Italy also. Some families returned back to Kerala, and from them we got so many cases. One family we cannot identify from the airport because they didn't reveal their identity. They directly go to the village and they visited so many relatives in the village without revealing their identity or like that. And from them we got several contact cases. But we acted immediately for the contact tracing, and we applied new technical methods for the contact tracing. Some IT-based papers helped us very much, and we traced all the contact within 1 week, and we prepared a patient flow chart like that, and we traced all the contact. That was a success. And we strictly take the contact peoples to the either in the hospital or in home isolation, and with the help of police and local self-government. That is the most important thing. In Kerala, we are able to tackle this problem nothing but because of the decentralized planning and local self-governments there. They helped us very much. And the second phase, we got 512 cases from Italy, from UK, and some foreigners were here. They were tourists. And one group, when they decided to go back to their country, we took them back from the airport because we have to test them. And without testing, we cannot send them back to their country. And fortunately, they came back, and when we tested, 10 people out of them also become positive. And we traced their contact also. If they went back to their country, it become impossible to track the contact of that people. When we took them back to our hotel from their airport, it became positive to trace that contact also. That way we are acting in Kerala, and at that time, second phase, we got 512 cases out of the contact. Not only contact, 70% is imported. People who came back from other countries, and 30% contact cases occur. If it become more than 30%, it again become a great problem. But because of our strict quarantine and because of our preparedness and practices, we were able to limit the contact cases and to contain to prevent the community spread also. Now, I'm not elaborating everything. Now we are in the third stage. Means all the 512 cases were discharged from hospital, out of which 3 died. Unfortunately, 3 persons died. But the mortality rate, the case fatality rate, we can say it is 99% if we calculated the percentage from the closed cases. Out of this, all of the people, all of the patients discharged, out of which 3 died and all others survived. And if we are calculating the fatality rate out of the living positive cases or live positive cases, we can say it is more than 93% and above the case fatality rate, because the second stage is over and third stage is going on. Means so many people is returning from other countries when we lift the some stringent actions such as the flight restriction, etc. Now it is over. Some flights are coming from other countries, especially from Gulf countries. Thousands of people are returning. When we ask them to register their name and their whereabouts in ORCA register and non-correlate affairs register, thousands, not thousands, but lakhs of people registered. And by road and by water and by air, people are coming. Now, again, the positive cases are occurring. More than 70 cases we got out of this third coming. And now we are again started our stringent actions and vigorous duties. And this local self-government helped us very much. We asked each panchayat and each municipalities and corporations to form a committee in their wards, a people's committee, to find out whether any peoples are coming their wards who have to undergo the quarantine, whether they are obeying the quarantine or whether they are jumping quarantine, and they are watching vigorously. Policeman is also watching vigorously. And this is the state in the our state. This is the condition in our state, and we are working hard. We are not taking rest. From January onwards, we are in the field. Our doctors, nurses, and even our field workers, ASHA workers, and all other, and policemen, and also the people's representatives, Kudumbashree members, everyone are in the field. They are strictly following the health department's guideline, how to do it, breaking the chain campaign, to wear masks, to wash hands with soaps and use sanitizers, and keeping social distance, etc. This is these things I can put in a nutshell what we are doing in Kerala. And also I express my thanks to Finance Minister. It is not because he is sitting with me, but because the real help. Because we have to collect the PPEs and 95 masks and everything properly. Without money, we cannot do that. And even if there is a very huge financial crisis in Kerala, but the government is helping health department to buy all these things. Yesterday he asked me, why are you not buying more ventilators? It is very costly. He is saying that can't you buy more than 10,000 or 15,000 ventilators to address this problem? It is a very costly thing, but we have more than 10,000 ventilators collecting all the private things also, private things. Not, I think 10,000 ICU is the ventilators up to 5,000. And we ordered for more ventilators, but it is not a money problem, but the manufacturing issue and the supply broke is there. We are not getting properly from the companies, because all are asking for this kind of equipments throughout the globe, and we are getting a little bit 200 or 300 or like that. But we are collecting, we want to collect more than 5,000 ventilators as early as possible. We already ordered for that. This is an example. I am not explaining each and everything. This is an example, and through the decentralized work and the stimulus package declared by the Chief Minister and everything, it is a coordination between everything. There is a coordination between everything, and my health department is acting properly. I think there may be some loopholes or faults that we cannot deny. But our doctors, my health secretary, my SMD and my DHS director, everyone is acting properly. They have ideas in their mind and they are preparing very good protocols and systems here. We are following that. And that way we are trying to reduce, trying to flattening the curve and to prevent the death. We want to slow down the curve and also we want to prevent death. That is the method of Kerala. And I think that is a good model. We cannot find no other method for addressing this system. I'm sorry, I become a little bit long and I have to explain everything. That is why, sorry for, okay, that is much. I cannot hear, sir. Here.
I'm just thanking you. See, she is having the first break from her office since the outbreak began. First visit to her home in Kanu. So I was reluctant, in fact, to call her and tell, no, you have to come on the webinar. So I hope you'll enjoy the one day in home. You have to come back, of course, to start my tonight. So have a nice day. Thank you.
To hear from the. Okay,
no, there is not going to be a holiday. I'm certain you will have your visits in Kanu, the hospitals, and so on. But there is all-round appreciation for the work done by the department from everywhere. Thank you very much. Thank you very much for coming.
Thank you.
Okay, thank you once again to Srimati teacher for this. Shailaja teacher for this excellent intervention. Sorry, I'm extremely sorry about that. Now we will give 1 minute each for the speakers from previous session. Just take 1 minute so that we'll conclude, and we are already late for the next session. Please cooperate. Let me call Dr. Nirmala. Dr. Nirmala.
Yes, I just wanted to point out, Isaac sir had asked, like, since I was also there in '97 with the People's Plan campaign, and I don't think there's any document better than that about the panchayats, about the local governments. It's a good document because it was prepared participatory with lot of people voluntarily engaging in that. And it was prepared, what I want to highlight, it was prepared at a time when we had very minimal technology available. And of course, the present documents prepared can't be compared to that. This is also, they are just started working, as Dr. Shegar said. It is good, but it has to be improved a lot. Thank you.
1 minute. Dr. Sunny. Thank you, Sunny, for cooperating with us. Now we are
Okay.
going to say
So I would like to add a few points. Number one, we have to strengthen our online system of the training. We are working on it, but I think in future we will be focusing on online type of because our strength right now is basically on the direct trainings like that. Second one, my suggestion to at the state level is strengthening the Ayangali Urban Employment Guarantee Scheme, which is a scheme for employment in urban areas. Of course, there will be shortage of money from the state government, but I suggest at the same time that we can look into the property tax, and its collection itself will increase the amount, and at the same time in future some slight increase in the property tax I think is possible. Third one, we are in Kerala producing lot of food, but actually it is not reaching the people. So there shall be a marketing system monitored by the government with the standards of quality like that. So for example, jackfruit is flooded in Kerala during the rainy season. There is no system of to the farmers to distribute among them. Then the other point is that we had focused on the commercial crops.
We are over the time.
One more. Then promotion of food. We have to promote food production. And finally, my suggestion is, if possible, in future, in the long time, minimum 10 cents of land to each family. Thank you, sir.
And I just wanted to add one more thing regarding the question on the disaster management plan. The weak part is about assessment of the situation. The State Disaster Management Authority had provided 31 layers of maps for every local government. That is a marvelous, revolutionary thing. All the details going up to the local government level. Then we need to also capacitate them to analyze based on all these maps and information. That's one thing which we need to add. Thanks.
Thank you very much. I think all the panelists were very, very disciplined, and we could, in fact, even with